cardiorespiratory fitness is a major risk factor for cardiovascular diseases, as well as many other chronic diseases. However, the understanding of how to interpret cardiorespiratory fitness has been challenged by the limitations in knowing reference values. This article reports revised and expanded reference standards for cardiorespiratory fitness measured by cardiopulmonary exercise testing done on either a treadmill or a cycle ergometer. Hi, my name is Dr. Lenny Kaminsky. I'm the director of the Ball State University Fisher Institute of Health and Wellbeing. Our recent paper, titled Updated Reference Standards for Cardiorespiratory Fitness Measured with Cardiopulmonary Exercise Testing, data from the Fitness Registry and Importance of Exercise National Database, or FRIEND, was released online ahead of print and will be published in the Mayo Clinic Proceedings in early 2022. It was less than 10 years ago, in 2013, that the American Heart Association issued a policy statement about the importance of cardiorespiratory fitness and the need for a national registry. The following year, an advisory task force was formed and developed the Fitness Registry and Importance of Exercise National Database, or FRIEND. In 2015, FRIEND published in the Mayo Clinic Proceedings the first preliminary reference standards for cardiorespiratory fitness measured with cardiopulmonary exercise testing done using a treadmill mode of exercise. 2 years later, FRIEND released the second report, also in the Mayo Clinic Proceedings, of reference standards for cardiorespiratory fitness measured with cardiopulmonary exercise testing, this time done on a cycle ergometer. Over the past 5 years, FRIEND has continued to grow through contributions of data from many laboratories and clinics across the United States. This updated report is approximately double the size of the preliminary reports and now provides data from 34 different clinics and laboratories across the United States. The main findings were that the 50th percentile values for each decade range from 1.5 to 3.8 milliliters of oxygen per kilogram of body weight per minute lower, and 0.4 to 1.9 milliliters of oxygen per kilogram per minute for men and women respectively. These lower values are unlikely to be due to decreases in cardiorespiratory fitness in the population over the past 5 years. Rather, the updated values probably more accurately represent the CRF of individuals across the United States, as we've now been able to collect more data which is more representative of the population. As with other cardiovascular disease risk factors, it is key to be able to identify values that suggest the patient is at increased risk for a cardiovascular event. There are clear threshold values that physicians use for making treatment decisions for high blood pressure, LDL cholesterol, and blood glucose. Decisions are made on the values for each of these risk factors, not behaviors such as sodium, saturated fat, or refined sugar intake. However, for cardiorespiratory fitness, clinicians typically default to the physical activity or exercise behaviors that drive cardiorespiratory fitness. Thus, a key value of this report for clinical practice is that it provides standardized reference values for interpreting a patient's cardiorespiratory fitness that is individualized to both the patient's sex as well as their age. For example, 5 METs is a value that has commonly been associated with increased risk of mortality. Using Table 3, we can see that for a 60 to 69-year-old man and woman, 5 METs would be at the 30th and 35th percentile, respectively. However, for a 40 to 59-year-old man and woman, 5 METs would be less than the 10th percentile. So a clear difference between age as well as sex for these kind of threshold values. Patients that desire to have or keep their risk of cardiovascular disease low should know all their risk factors. Patients can benefit from these age and sex-specific classifications of their cardiorespiratory fitness versus the one value of 5 METs that's applied to all. With this information, patients can have a clear understanding of the cardiorespiratory fitness level related to the risk of cardiovascular disease. Although these reference standards are a major advancement, continued growth of the FRIEND registry will benefit our understanding. As more data is acquired, next steps in the research will be to determine if differences in cardiorespiratory fitness are apparent due to factors such as geographical location, living in urban versus rural areas, and due to patient characteristics such as race. For example, last year at Mayo Clinic Proceedings, we published a kind of a preliminary report of cardiorespiratory fitness differences between different regions across the globe. So as we grow the Friend Registry internationally, we'll be able to have a better understanding of some of these differences that we've seen at different locations around the globe. These data will further advance our understanding of the importance of cardiorespiratory fitness for cardiovascular disease, as well as for other chronic diseases. Thank you for taking a little time to listen to this video, and I hope you enjoy the article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.